if you are working and maybe you're 65, but your spouse is on the group plan with you and they're 63,
Hmm.
you're gonna, you have to keep working because if you enroll in Medicare, your spouse might lose coverage, and that's another challenge. Do I continue to work so my spouse can get affordable health care? This year's 2025, there's talk about getting rid of advanced premium credits that help keep marketplace or people who don't have a group plan affordable health insurance. That's changing. That might determine how people approach whether they enroll in Medicare and have the younger spouse who's not 65 get in on a on the marketplace. So I would say things change, right? And that's just one of those things. Be aware of what's going on in the market, not just for you and the advantages of being on Medicare, but your younger spouse who needs that coverage because health insurance is going up.
Sure.
Yeah, and I would say that along those lines, if a situation where you call you and say, "Hey, I heard I have to sign up for Medicare," say, "No, you don't. Here's what's going to happen. As long as you have credible group health insurance, and you need to check the HR department, there's this credible, because I have a big company and that I know of that they sent out a letter to every one of their workers saying, "Hey, our health insurance is not credible, which doesn't meet the standard that they need for Medicare, which means they have to sign up for Medicare or they're going to pay the late penalty fees." But so to say, hey, here's what's going to happen. As long as your insurance is credible, let's say 2, 3, 4 years down the line, when you finally decide to retire, then what's going to happen is we're going to get contacted by your insurance company. CMS says to Blue Cross or United Healthcare or whatever, "Hey, find out if Cary was insured," and we just have them then fill out a form L564 from their HR department, says yep, and then it's done. So it's not a big deal, as long as you know that, as long as you've checked that you've got credible health insurance. So you keep working. 65 doesn't mean anything. You keep working and sign up for Medicare, or you can keep working and stay on your group health plan or your spouse's group health plan, and just we need to have that conversation. Once you have it, then you'll be like, okay, good. Now we're in a good place.
Yeah. If I think you said if somebody has either a group health plan or an HSA, then you can't get Medicare. Is that a true statement?
What he was referring to, and there's a nuance there. If you have a health savings account and you have someone contributing to it on your behalf or you're contributing, you cannot contribute to that if you have Medicare. Part A is Medicare, even though it's free.
Yeah. Okay.
So now all of a sudden it's like, don't sign up for Part A, because if you love your HSA, which people love them,
Right.
then don't do it, even though Medicare is free. And that's that thing that doesn't
Yeah.
resonate with people. It just doesn't feel right. Why wouldn't I get in something that's free?
Right.
Well, if you have an HSA, okay, let's have that discussion. How important is it to you?
Okay. So let's say that HSA is very important and they're turning 65. If that HSA is important and they carry that to 66 or 67 or whatever, and then decide to get Medicare, is that penalty still assessed?
No. So 6 months before they sign up for Medicare, that Medicare says they should not contribute to that HSA anymore. So 77, 78, then then it's not a problem.
Okay.
So it's fine. I
So
would,
it's kind of like a get out of jail free card to have an HSA that you carry past 65.
We're assuming you have an HSA is contributing because you're still working. You still have earnings
Sure.
at work and you have creditable coverage,
Sure.
which in this case is usually a high deductible plan. And I think that's, that whole thing, and the government really wants people to have HSAs because they know there's going to be this copay responsibility. We can't keep raising premiums. What about the people who have good genes and don't go to the doctor? They shouldn't be, supplementing the people who on the flip side. So
Hmm.
these big deductibles are becoming a challenge, right? So HSA, they're trying to figure that how to get HSA education, get people to be aware of what it can do for you.